Afternoon.
This is a look inside the Irving Interfaith Clinic, where thousands of residents have gotten medical help. One of the first patients seen in a room like this one was a man with no money and no insurance. Turns out he had skin cancer.
It was life-threatening, and so they called in a specialist in the clinic. They did 3 surgeries to try to get that all gone.
Soon the man was cancer-free, and it didn't cost him a penny. His life was saved because of a doctor's visit. The Irving Interfaith Clinic sees the need people have for healthcare, and their doors are open to anyone in the city who has no health insurance and a low income.
We're trying to make sure that they have a home, they have a doctor, they can pick up the phone call and make an appointment and come see somebody.
Today, the clinic is recognizing key organizations that have donated to keep the nonprofit organization going. And this ribbon cutting, hosted by the Chamber of Commerce, marks the clinic's 2nd year in a brand new facility, a building that is paid for by local donors.
We have been able to serve 6,000 patients this year already through this facility given to us by the Irving Hospital Authority, Baylor Irving, and the Irving Healthcare Foundation.
Some clinic employees are paid through grants, but the majority of the doctors are volunteers. The clinic goes above and beyond your basic doctor, though.
We believe in what they do here. We know that lives are saved or made better.
There are primary care physicians and dentists available at this clinic, but 90% of the patients that come in are diabetic. And they come into this room again for free to learn how to eat right and take care of themselves.
People bring their diabetes under control and they don't lose their vision. They don't lose an arm or a leg or a foot.
To be in pain and not have access to care, and then to walk into someone who will give you free care, it transforms lives.
This is the only free clinic in Irving. Many say the purpose of the nonprofit boils down to basic human compassion.
I see this as kind of a throwback to those days when people really cared about people.
The volunteers do it because we care. We just want to help people. So that's our motivation.
These are men and women who, when they look across the counter, they see their moms, their dads, their brothers and their sisters. And that level of compassion does more than probably the medical care we can even provide. And we provide a lot of medical care.
The clinic is located right next to Baylor Medical Center at Irving. They work tirelessly to keep residents healthy and happy. And they say they could always use more volunteer physicians. Brooke Pratt for Envision Irving.